This video is a description of the running horizontal mattress suture, a variation on the typical horizontal mattress suture technique. This technique is ideally suited for long, linear wounds in which there is a fair amount of tension on the wound edges, or when the edges adjacent to the wound itself have atrophic or macerated skin that won't hold suture threads well. The first step is placement of an anchoring suture. This is a suture thrown in typical simple interrupted fashion, with the major difference being that the bites that are taken are slightly larger on either end of the wound, as if you were going to throw a typical horizontal mattress. The shorter end of the suture is cut, and the longer thread of the suture attached to the needle is then used to run the horizontal mattress suture. Each subsequent throw of the suture will be placed as if you were placing a regular horizontal mattress suture, with wider and deeper bites relative to the wound margin. Typically, this is about half the radius of the needle distant from the wound margin. Now each subsequent throw will begin on the ipsilateral side of the wound edge, so you'll essentially re-enter on the same side of the wound with your wider and deeper bite to exit on the contralateral side of the wound. For purposes of this demonstration, a 3/0 nylon suture is used. In reality, you'd select your suture size based on the area of the body and the level of tension that you're facing with a particular wound. A 4/0 nylon would generally be acceptable for a wound on the trunk or extremities. When used on the face, a 6/0 nylon suture would be preferred. The running horizontal mattress suture has many advantages relative to the typical horizontal mattress suture. Like any horizontal mattress suture, it allows for excellent eversion of the wound edges, but additionally, running the suture allows for increased efficiency of suture placement, because the suture material doesn't need to be tied off frequently. When placed well, this type of suture doesn't require any additional sutures to be placed closer to the wound edge, which reduces the risk of cross-hatching and train tracking marks that are sometimes left by simple interrupted epidermal sutures. There are also several disadvantages of this technique. One is that, like any horizontal mattress suture, it may leave gaps in the center of the wound. A potential solution to this problem is to place an additional layer of simple interrupted sutures closer to the wound edges. Of course, in doing this, you would lose that benefit of decreased train tracking marks. Another disadvantage to consider is that the wide arc taken by the horizontal mattress suture will put increased constriction on the tissues and can lead to increased strangulation risk. There are several different ways to finish placement of this suture. Perhaps one of the simplest is to leave a loop in the penultimate throw of the suture, and then use the needle driver to perform an instrument tie, simply grasping that extra loop of suture and tying across the margins of the wound. Finally, the extra threads of the suture are cut, and the closure is achieved with excellent wound edge eversion and good approximation of the central portion of the wound. Here you'll find some references to learn more about this technique, and to learn more about this and other basic and advanced techniques in wound closure, visit www.lacerationrepair.com.